did you know that almost 1 in 4 Canadians are considered caregivers? And almost all caregivers are unpaid, and they were most likely thrust into the role of caregiver with no formal training. It could certainly be stressful, exhausting, and overwhelming. Well, as our population ages, more care is required at home. However, it's putting an enormous strain on our healthcare system. And in fact, the number of people waiting for home care through the CLSC has more than doubled in the last 4 years to over 20,000 people. That's just waiting to get home care services. Well, to help us out, I'd like to bring in Kirstin Bennett, Managing Director of Premier Home Care. She's also a certified professional consultant on aging. Kirstin, welcome back to Life Unrehearsed.
Thanks, Matt. Always happy to be here.
Well, thank you for joining me. You're filling in at the last minute, Kirstin, here. We had a little emergency with our prior guest, and I really appreciate you coming in on a busy Sunday for you and your life as well.
My pleasure.
All right, Kirstin, the majority of Canadians want to age in place. However, it can be challenging, as I've mentioned. And so what are some of the challenges families are facing to age in place?
Well, in the elder care planning field, the biggest challenge I see is being able to create an environment that is safe for this to happen. Ideally, people will think about that as the foundation. So there's a need to come together with family members to understand what that actually means. So whether it be home modifications, medication management, emergency alert systems. Are people living nearby? Because if they're not, we need somebody who's going to be checking in. Is there proper nutrition, hydration, proper hygiene? And then, what about socializing, right? We don't want to just be stuck at home. So socializing is important to discuss, transportation. I think another challenge that is often there is denial. Mm-hmm. This happens sometimes for better or for worse, and no changes are made. And this happens sometimes just out of general personality factors like pride, for example. Mm-hmm. There's fears of change, health issues that make it difficult to see the situation for what it is. So it definitely brings a challenge to aging in place.
Yeah, not easy. And then, once you start getting into either mobility or cognitive challenges for a loved one, a spouse, let's say, then there's home adaptation like you were talking about, yes. Right? And making sure that slips and falls are trying to be prevented. And so lots to go into it and thinking about what can be done to age in place. We're going to talk a little bit more about that. But, you're really a big advocate, Kirstin, about caring for yourself first. And I really believe in that. We've had several guests on our show talk about this. So what are some of the key factors that family caregivers need to consider helping themselves and therefore help the ones that they love?
Right. So I agree. It's so important to point out that family members can become caregivers overnight or over time. So it really is important to think about oneself and not only about the person in the need of care. So I think it's just to understand that resources are out there in the community and to educate yourself about particular diseases or conditions that you may have concerns about. Understand the costs for the support and that there are funding options out there. Also, in terms of legality, legal documents, I think that's important to make sure that's in place. And honestly, know that there are support groups and organizations available, and I really encourage people to use them just to make the time because it really helps in the journey. And finally, I would really say that recognizing small wins are actually big wins because the effort is really what's important, not always the outcome. Acceptance for support really takes a lot of time, so caregivers have to just recognize their efforts.
Yeah, we bring very, very good points, and I would agree. Knowledge is power. Kirstin, you and I are in this world every day, and it's changing for us all the time. And so could you imagine just being thrown into this role of caregiver, that trying to figure it all out? But there are resources out there, and that will provide some self-peace of mind as well, because you do need to take care of yourself first, as you so rightly so advocate for. Listening to Life Unrehearsed, Matt Del Vecchio here, and I'm talking about aging at home, or as it's sometimes called aging in place. And I'm with Kirstin Bennett from Premier Home Care. Now, Kirstin, what is the difference between public home care and private home care?
So, I mean, public home care is typically the CLSC sending their own caregivers to the home up to like maybe one or a few times a day or a week for various services, task-oriented, such as dispensing medication, compression stockings, bathing, dressing, undressing. And it's just that they're usually different people during the day that are running around trying to fill an almost impossible schedule. There's a lot of demand. So it's very demanding on the caregiver if they don't know if the person's going to be arriving or not. Sometimes it can be impersonal for the client. So in private home care, you have the same caregiver or team of caregivers who eventually gets to know the person and the routine. So it's just a much more personalized service. Of course, public home care is provided at no cost, where private is a paid service. But you can get private home care set up almost immediately, where the wait time for public is need priority based. So often there's a delay.
All right. No, it makes sense. We do have our public health care system. As you heard, waiting lists are getting longer. That's the first priority for families to try. And it is at no charge. There's pros and cons to it. And then if you have to tap into the private sector, then that's a possibility. So, we're quickly running out of time, but what I'd like to talk quickly about, Kirstin, is government tax credits. And we've mentioned that, by the way, the only way to get public home care, right, is through the CLSC, right? There's no two ways around it. You have to get evaluated and get yourself on a waiting list for some home care. So we encourage that process to start because, as you see, it takes a lot of time, doesn't it?
Correct.
But in the private sector, the government is recognizing that it's a problem. Santé Quebec has been cutting, and there are some tax credits out there, aren't there, for if you are going to hire privately?
Yeah, for sure. I mean, the most important one that some people know about it and some people don't. It's always surprising to me because it's really a great opportunity. It's called the Home Support Tax Credit. Which basically, to be eligible for that, it can be, you have to be over the age of 70 and a resident of Quebec. It's up to 39% that you can get back on home support services. So if you meet both of those conditions, you can claim the tax credit regardless even of your level of dependence. It does take in consideration your income and where you're living, but it's definitely designed to help people have support at home. And
to be able to do that, it's 39%. It's not just a few percentage points. It's really a good chunk. So know that there are some tax credits. Again, that's all part of that knowledge is power. Kirstin, we're already out of time.
No worries.
We can go on forever, but I want to thank you for taking a little time and really filling in here on a Sunday. I know things are busy for you. And how can people get a hold of Kirstin at Premier Home Care?
Well, the easiest way to connect with us would be either on our website. There's a form, premierhomecare.ca. You can give us a ring at 514-718-6553 or send an email to info@premierhomecare.ca, and we'll be happy to start the conversation.
All right. Thank you very much, Kirstin, for joining me.
Hey, it's my pleasure.
All right. That's Kirstin Bennett, the Managing Director of Premier Home Care.